have verified my order. My permit is signed. And I would go ahead and pre-medicate my patient if it was ordered. But for now, I'm going to gather my supplies here. And I'm going to go ahead and head to the patient's room. So, entering my patient's room, knock, 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 providing privacy, performing hand hygiene. Good morning, my name is Samantha. I'm going to be your nurse today. Can you please tell me your name and date of birth? Ferdinand Foley, 9/23/69. Got my order right here. Ferdinand Foley, 9/23/69. Bracelet, Ferdinand Foley, 9/23/69. All right, so we got the right guy. All right, so Mr. Foley, your physician ordered that you receive 1 unit of packed red blood cells. The infusion itself should take no longer than 4 hours. If you start to experience any symptoms such as fever, chills, rash, itching, flank pain, or dyspnea, please report those to me. But as of right now, let's go ahead and get this blood started. So we're going to do a cardiopulmonary assessment. We're going to go ahead and we're going to go ahead and assess breath sounds, respiratory rate, heart sounds, heart rhythm. I'm going to do a neuro exam and check urinary status as well. When those things are complete, we're going to go ahead and assess our IV that we're going to be running this through. If we were going to do this peripherally, we would want a 20 gauge or larger. 18 is preferred to do blood through, but for the sake of this video, we're going to be running it through a central line, which will be this right here. All right, so with that being said, our side is looking good. It's clean, looks like a good IV. We're going to go ahead and open up our tubing. Alright, got all of those off. So move those down just a bit. I'm going to close all my clamps on my tubing here. Alright, clamps are all closed, so now I'm going to go ahead and spike my bag. Alright, bag is spiked. We're going to go ahead and hang it up. I'm going to open up my clamp up here, get some fluid down in here. I'm going to squeeze it. I want enough fluid in here that it covers my filter. So we're just above the filter, and we are just above the filter. So I'm going to open up my bottom clamp here, and I'm going to prime the rest of my tubing. Okay. Tubing is primed, so I'm going to go ahead and hang this up. My brain is not working today. All right, we've got our saline primed, so we're going to go ahead and glove up. At this point, if Mr. Foley had any fluids running, we would go ahead and discontinue those, but he does not. So we're going to go ahead and unclamp our lock here, get a alcohol swab, and we're going to scrub our port 10 times. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We are gonna get our syringe here, our saline flush. Since this is a central line, we want a 10 ml syringe or larger, which I have right here. So I'm gonna go ahead and aspirate for blood. Got blood. I'm gonna go ahead and flush 5 to 10 mils in a pulse-like fashion. All right, so flush well. So I'm gonna get another alcohol swab and scrub again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Grab my tubing here, take this little cap off, and I'm going to connect my tubing. Alright, so now I'm going to go ahead and open up my fluids here. We're going to run this at a KVO rate of 20, which is 20 mils an hour. While that is infusing, I'm going to be assessing him for any signs of infiltration, and he's looking good. So I'm going to go ahead and remove my gloves, perform hand hygiene, make sure that he is comfortable, that his bed is low locked, side rails up, call light within reach. And we're going to go get the blood from blood bank. Okay, so let me grab my gloves right here. Empty out this table a little bit because I ran out of room. All right, so I've got my blood and I've got my little consent paper here, or not consent, but to verify with another nurse. So we have our blood, so now we're gonna verify with a second nurse all of the information to make sure that this is the correct blood product for Mr. Foley. So with that being said, I have Ferdinand Foley, date of birth 9/23/69, date of birth 9/23/69, medical record number 45632, medical record number 45632, account number 111234, account number 111234. Mr. Foley is going to be receiving B negative, and I've got B negative right here. Blood bank ID band is PDV 4961, PDV 4961. Unit number is 001481, unit number 001481. Excuse me. Expiration date of 5/26/25. Expiration date 5/26/25. This is compatible. And so I'm gonna go ahead and have my my other nurse sign here, and we're gonna go ahead and get this rolling. So with that being, now that we have verified, we are going to go ahead and get a set of vitals on Mr. Foley, that being blood pressure, heart rate, respiratory rate, temperature, and we would go ahead and document those. Now that we've done that, I'm gonna go ahead and get gloves on again. It should not be this hard to put gloves on. All right, gloves are on. We're gonna go ahead and clamp off our saline, and we're gonna spike our blood. Don't want to touch the ends of anything here. All right, blood is spiked. Go ahead and get this hung up. So now that we've got this hung up, we're gonna go ahead and open our clamp on our blood. We want some down here in the chamber in this filter, and we want to leave some room so that we can make sure that it's still dripping, and as you can see, it's going quite well. So we're going to open up our bottom clamp here. We're going to start this infusion. We're going to start it really slow. For the first 15 minutes, we're going to slowly administer this blood. So we're going to go at a rate of 50 to 75 mils an hour. During that first 15 minutes, we are going to stay with Mr. Foley in his room the entire 15 minutes, and we're going to be taking his vital signs every 5 minutes. Now, after that first 15 minutes, as long as there are no complications, we will increase the rate per the order. Usually it'll be between 75 to 125 mils per hour. At that point, we will be assessing his vitals every 15 minutes times 3, and then every 30 minutes for the duration of his transfusion. Throughout the entire time that he is receiving the blood, we are going to be assessing for signs of a reaction. So that's the fever, chills, itching, the rash, the flank pain, and the dyspnea. If any of those were to arise, we would immediately stop the transfusion, and we would notify the physician. But Mr. Foley is a good patient, and he is handling this blood well. So we are going to go ahead and remove our gloves, and we're going to perform hand hygiene and make sure that he is comfortable, his bed is in a low locked position, side rails are up, and call light is within reach. Okay, so then we're gonna, let me get another set of gloves here. So then we're gonna come back. We're gonna say that his blood is completely transfused. So at this point, we are going to clamp off our blood clamp up here, and we're gonna open this saline one back up. And this is going to allow that saline to flush what's left of the blood through the tubing into Mr. Foley. So once the blood has been completely infused, we are going to go ahead and assess Mr. Foley again. So we're gonna do the cardiopulmonary, so the breath sounds, respiratory rate, heart rhythm, and heart sounds. We're gonna do the neuro exam, check urinary status, and do vital signs. Once we have all those things done and completed, we're gonna go ahead and glove back up. We're gloving back up. All right, so we are going to go ahead and make sure these are clean before I disconnect it, not spill it everywhere. So we're gonna go ahead and discontinue the blood. If we were actually in the hospital, we would go ahead and take this back up to blood bank, all of the blood product, but for the sake of this video, we're just gonna verbalize that all of the blood products would go back to blood bank. So I'm gonna get my alcohol here, throw those in the trash. I'm gonna scrub my my port here 10 times. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Toss that. Again, central line, so we need a 10 ml syringe, which I have right here. We're gonna attach to flush, 5 to 10 mils, flushing it. through the IV. It's making noise. All right, so flush well. We're gonna disconnect this, get another alcohol pad, toss those in the trash, and we're gonna scrub this port again 10 times. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Got my heparin flush here. Go ahead and remove the cap. Attach my heparin. We're gonna flush with heparin 100 units per mil if it is a central line without a valve. So flushing this heparin. I'm gonna go ahead and clamp my IV here. Remove my heparin. At this point, if Mr. Foley had any IV fluids that were ordered to be resumed, we would go ahead and resume those, but we're going to say that he doesn't. So we would go ahead and just make sure that he is comfortable. His bed is in a low lock position, side rails up, call light within reach. I'm going to go ahead and take gloves off. Hand hygiene, and since he's good, we would go ahead and document all of this on the I&O record or sheet, and then we would also want to document our final assessment that we did, the rate, and if Mr. Foley had any reactions, we would go ahead and document all of those things as well. And then